Peron-Wildes. What do we need to know?
Well, first I'd like to disclose that I am fully vaccinated, and my son with autism is fully vaccinated. And I would like to point out I have very high respect and regard for the Department of Health and for the people that are here that are working towards immunizations, and I think their intent is honorable. But I am here today to represent the many parents in our state of Minnesota that have children with autism and are concerned about our vaccine schedule. I am the founder of BEAT, Biological Education for Autism Treatments, and we have over 700 members from families of individuals with autism. Many of those families wanted to come and testify today, but as you can imagine, their lives are very difficult. And so they've asked me to speak on their behalf.
And Ms. Peron-Wildes, I hope you'll let them know about July 17th.
Yes, we will certainly post that.
Okay, thank you kindly. What else do we need to know?
Over the last 12 years, we feel we have not seen enough research to show that our current vaccine schedule is safe. All of us have seen personal correlations between our child's regression into autism and the circumstances that were surrounding the timing of their vaccine. From anecdotal surveys of our family, 87% of the children with autism had one or more vaccine sequenced when they were ill versus their neurotypical normal siblings of the same family. Only 3% of them were vaccinated when they were ill. No one is studying these types of research. No one is looking at these factors. When research is being done about vaccination, the things that we see that are promoting or causing or being the tipping point are not being researched. We see with increased use of daycare and common illnesses, colds, ear infections, it's hard to find time in that vaccination schedule to not vaccinate the child when they're sick. It's very likely that a child is sick when they are vaccinated. Today, we have more toxins that kids are getting exposed to. We know that babies born today at day one have more toxins in their body than any other generation before. And we don't understand that ramification on their immune system. And then combining that with that heavy administration of a vaccine schedule. It's common sense that if a child is sick, we do not further strain their immune system by giving them several diseases for their body to fight off. When my 17-year-old son, who is autistic, was vaccinated in 1997, it was the current recommendation from the CDC at that time to not give vaccines to a child when they were ill. It was advised to delay them. When myself and other families brought this to their attention, the recommendation suddenly changed. Overnight, it changed to strongly recommending to continue the vaccine schedule when a child is sick because the risk of getting the disease is greater than waiting. Our parents find that absurd. There's no medical research that was done to prove that it was safer to delay the vaccines versus administering them when they're sick. This just changed after we pointed it out. Adding more vaccines to the mandated schedule, we feel will only increase the possibility of a child having an adverse reaction in these more common situations. We have thousands of stories of abnormal reactions, and the stories go largely ignored. Because of the complicated legal process and stigma that surrounds reporting a reaction is difficult and challenging, we have very little good data. For instance, my son was part of a research study that showed the majority of children with regressive autism have inherently abnormal cytokine immune responses to several other vaccinations. Even though this is proven for my son in the lab, we were kicked out of vaccine court to hear his case because we filed 2 months too late from the time allowed since he had those vaccines. Needless to say, we were a little busy trying to deal with that child to control him, find him treatments over the recent years after he was diagnosed. So the reason why I'm here today representing our parents is we don't want to see the continuous growth of possible adverse reactions and the rise of childhood diseases. Over the past 15 years, we do not think it's ironic that as more vaccines are added into the childhood schedule, the increase in autism continues to grow and not decline. Science and technology have not caught up to us fully understanding the true ramifications of vaccines on children that are susceptible to an adverse reaction. Furthermore, we do not have a political system that supports research to challenge the status quo. So how will we ever know the real answer? My confidence and our parents' confidence in the vaccine schedule and the national experts making the recommendations are shaken. It was noted about the rotavirus vaccine and the problems that we had with it. No one failed to mention the researcher who created that vaccine had a financial conflict of interest, and he should have never been able to actually create that vaccine. It should have never been released in the first place.
Could you say that again?
Sure. In the rotavirus vaccine, the research that developed it had a financial conflict of interest. So we're in a tough situation. I have parents that ask me all the time, what should I do? They know our story, they hear it. I do not tell people to not vaccinate. I don't feel that's right. But I do tell them they need to do it carefully. They need to pick which vaccines they're really concerned about. They need to make sure that the child is not sick, nothing, no cold, nothing. They need to make sure that they separate them as much as they can possibly do that. But many times parents come back to me and they say, well, will that guarantee that this won't happen or something won't happen to my child? And I can't tell them that it won't. I'm concerned that parents are not vaccinating their children because my child is very sensitive. He gets IVIG, immunoglobulin treatments every 3 weeks to keep him alive. He almost died when he was 7 because he was so sick. His immune system, his gastrointestinal system is so havoc that he has to keep alive from additional supports, medical supports. Lastly, I feel this question is inherently a question of civil rights. My child had no decision in this ramification that has taken his basic freedoms away. He was a healthy, vibrant, beautiful child one day, and then the next day after his vaccinations, he stopped walking, he stopped talking, and he fell into the abyss of autism. He will never drive, will never be left alone. He cannot communicate his most basic needs and wants, but yet he has a brilliant mind trapped in his body. His life is forever changed from that one fateful day that we had no choice in. We were just following the system designed for one size fits all. We actually had him at the Mayo Clinic for 3 years, and they tried to help us, and they didn't validate any of our concerns and didn't really think there was anything wrong with him. And in the middle of the night, one of the nurses called me and said, your son is very, very ill, and no one here will tell you that. And you need to, no one at the University of Minnesota will tell you that either. You need to go and find a doctor that will be willing to treat your child. So we take him out of state. He sees 5 to 7 doctors out of state that have helped him to survive and grow. The truth is, we're a very diverse population with diverse and complex systems. We grew smart after having our second child, 13 years later. We had her cord blood analyzed by all the researchers and doctors that we work with, and guess what? She has all of the 17 genetic predispositions for autism or autoimmune disorders, and her cytokine study showed that she has the same abnormal responses to vaccines as her brother. And she's also a low glutathione individual, which our whole family is. So we had to make the tough decision to not vaccinate her. Does this make me nervous? Yes, it makes me nervous. Do I think this is our only opinion or our only option? Yes, I think it's our only option. I do not have confidence in our current vaccination process that we will not repeat what happened to our son. I would never forgive myself if it happened to me again. Never. And I'm extremely grateful we have a conscientious objection. And if we didn't have that, I don't know what I would do. I'm happy to say my daughter is now 4 and thriving. We treat her very well nutritionally with supplements, and we promote her immune system to be strong. She's very healthy. She's never had a serious illness. She's in school. She's extremely social and bright. She's had a boyfriend for 2 years, and yes, she's 4. She can read. She can do 2nd grade math. She was recently tested and passed for early entrance to kindergarten, and most importantly, she loves her big brother very much. I feel very lucky to have the resources, the knowledge, the courage to raise her in a way that can mitigate her chances of developing autism or other serious illnesses, but most families are not so lucky. Most families just follow the system and trust that all will be fine for them. That is why we have to be sure what we do for our most precious resource, our children, is the safest route possible. The solution that I have presented many times that has not been undertaken is for health departments to develop testing similar to the PKU test a child gets when they are newborn in a hospital, to see what children will be likely to have adverse reactions, and then do not give them the vaccines they might have a problem with. This is the closest thing we could give to parents as an insurance policy and would increase the willingness to vaccinate among parents. I'll close with my favorite quote. All truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. And third, it is accepted as being self-evident. Thank you for your time.
Thank you, Ms. Peron-Wildes.
Thank you. I just wanted to talk a little bit about the issue of exemption and why we feel it's not enough. Many of our families, first of all, I think it was brought up earlier, we do have refugee families here. We work extensively with the Somali community, which has an extremely high rate of autism. It's noted that their cases are closer to 1 out of 30 in their community. And in fact, there's no word for autism in the Somali community, so they actually call it the Minnesota disease. And one of the issues that we have with the community is that they've been angry, and I know the Department of Health has tried to work with them to bring their vaccination levels up, because they've seen reactions, and then the child's developed autism, so they think it's more than a coincidence. And what they have said is they don't understand that they can exempt. They told it was by law they had to, because a lot of them obviously couldn't read English, and so there are some issues there of language. The other thing that is a little bit more disturbing is that perception from doctors. As you know, my family is a little bit more predisposed to adverse reactions. Many people in our family have low glutathione. That has a lot of different implications. And so when I've had siblings or cousins that start vaccinating and they start to see adverse reactions, they freak out, pull back, and then start to do vaccinations differently. It's very difficult to find a doctor that won't do the mandated schedule, that is willing to go off of a different schedule, to do something that's a little bit more unique for that child. It's very hard to find people that are willing to compromise. And I think that's a lot of the answer here, is that it can't be a one-size-fits-all. It needs to be something that is person-centered, instead of, just evidence-based. It has to turn into something that's person-centered for that individual. I've had a personal family member, a cousin who has both glutathione, and she has autoimmune disorders, and when she decided, she was vehement to not vaccinate her child. And when she went for the 3-year-old checkup, not only did her doctor come in, but that doctor brought in other doctors and sat there and chastised her, and basically she said she couldn't leave until she vaccinated her child. She was in tears in front of the doctor. That day they gave her the MMR, she was sick. They went home. She called me immediately. She's like, I can't believe I did that. I really felt coerced. And the child did have a reaction. She was having seizure-like behaviors. She had other medical issues that arose. When she called her clinic and wanted them to report it, they refused to report it. I encouraged her to report it by herself, which she did, but nothing ever came of that. And the child is thought to have developmental delay. She is behind. So, it's a challenge, because this perception of mandating, a lot of people feel they don't have a choice. Even though I understand it's on the form, Many times those conversations aren't talking about form. You're not looking at a form. You're talking to your doctor. And we need to send a message to the doctor that they can do something different than that mandated schedule if that's in the best interest of their child. And I think that's something that has not really been addressed. It's interesting because I do environmental design, buildings, and I teach at the University of Minnesota, and I work on buildings like this, follow LEED systems that our state is very involved in. And so a lot of my research, I look at how toxins affect people and how we can do safe, and I can tell you that carpet and chairs and things is much more safe than most things that we're talking about today. And one of the rules of thumb that we have is when you're dealing with toxins, you know, the things that you have to worry about the most are things that you're injecting or you're ingesting. And then, so things that you're eating, things that are getting injected into it. Then you worry about what's touching your skin. And then you worry about what you're breathing. But so, to me, the things that we inject into a child are paramount. Because that's something, as a parent, I can't choose. I can't choose to get the MMR single dose vials anymore. It's not available. If I want to get the measles, and then 3 months later get the mumps, and then 3 months later get the rubella, I can't do that anymore. They won't make them that way. And so I have very limited choices. I can do all of it or none of it. And there's got to be a compromise to learn that. So my fear is adding to that mandated schedule, people will feel that their choices will be more compromised and an already compromising schedule. And as other people have testified, the system is working. I don't think we need to add to it. And if anything, by adding to it, we're limiting the liberty and the choices of those